Here. And without further ado, I'd like to go around the room with a short round of introductions so that we can all get to know each other real quick. Please, just short introductions. If we all took 2 minutes, that would be half of our meeting. I will start with you. We'll kind of go around this way. And before you begin, some people here today are just here to listen, and some people are here to chime in and speak a lot. There's no rule. This is a roundtable discussion, so thank you all for being here.
Hi, I'm Natalia Callis. I'm the Regional Outreach Specialist with the Regional Director, Mr. Anton. Good morning, I'm Nikki Gaskin-Capehart, and I'm the Deputy District Director for Constitutional.
Hi, I'm Karen Cole, and I'm the Vice President of the Board of Local League of Independents.
I'm Ed Briggs, I'm the President-elect of the Florida Nurses Association.
Saul Roston, I'm the Secretary of Civilians Business Outreach Director and based in headquarters.
Anton Gunn, HHS in Region 4, which is based in Atlanta.
I'm Tom McCollum, President of Healthcare Recruiters International in Central Florida.
Mona Mongit, solo private practitioner and Southeast Regional Director of the Doctors and Board of Directors.
I'm Gwendolyn Warren, Health and Human Services Director of Pinellas County, charged with the responsibility of redesigning our indigent health care delivery system in anticipation of the Affordable Care Act. And for me, this is a very exciting discussion that we're going to get.
Great. Well, thank you all for your time and your attention and for being here this morning. This is an exciting part for us in the department. Just to tell you a little bit about our role in the regional office, it's our responsibility as the senior officials in the Southeast for the department to be the key liaison between state government, local government, and interested stakeholders as it relates to our 330 programs and services that we operate at HHS. So part of our work is always doing the external affairs and the outreach. And when we received a call and contact from Know Your Care, based here in Florida, we wanted to put together some small business roundtables to talk about the benefits in the Affordable Care Act. We're very happy to oblige them and to travel around the state of Florida and meet with the good people in the state to make sure that they understand the new benefits that are available to them, but more importantly, the opportunities that are before the state and the communities of the state to take advantage of what the Affordable Care Act is bringing to the table. So first, I want to give kind of a broad picture, big picture piece of what the Affordable Care Act is, what it does, and the opportunities that it creates. First, there are 10 titles to the Affordable Care Act. I won't bore you and try to read all 10 titles off to you, but I'll summarize them effectively to answer this question. What does the Affordable Care Act do for Americans and for people in this country? It does 5 things. Number 1, it expands access to coverage for people who currently don't have it. Okay? It expands access to insurance coverage, a coverage of some insurance program for people who don't have it. Number 2, it makes coverage for people who do have insurance more affordable by lowering the costs. And it also helps people who don't have coverage now to be able to afford that coverage by lowering the costs. Number 3, the Affordable Care Act does something which is really important to all of us, and that is improve quality in healthcare and focusing on how do we get better quality. Because I don't think anybody in here wants to drink poor quality water, nor do they want to live in a poor quality house or drive a poor quality car. But we all want high quality products, and healthcare is a product that we consume, and so it should be high quality because that helps us to lower the costs in the healthcare system and improve healthcare outcomes and strengthen people. So quality is the third major focus. A fourth focus in the Affordable Care Act, and this is a big one, and that is prevention and public health. The Affordable Care Act is not just the back end providing insurance and coverage for people when they need it, but how do we work on the front end to lower the cost of the healthcare system by focusing on prevention, focusing on wellness, focusing on making sure that we can protect against infectious disease, make sure that we can continue to do research around infectious disease to help us to treat illnesses before they become acute care situations. That helps us to lower costs, and it also improves the health of our communities. And the Affordable Care Act makes significant investment in public health and prevention. And then the fifth piece that the Affordable Care Act does, it gives consumers and patients more protections in healthcare. It also gives them more choices in healthcare as they make their healthcare decisions. So those are 5 ways in which I like to summarize the Affordable Care Act. Now, I just really glazed over it by trying to break it down into 5 pieces, because each one of those dimensions that I discussed has multiple facets and multiple benefits for multiple communities, okay, and multiple constituencies. I'll also say to you that the Affordable Care Act is not a piece of legislation that could transform healthcare overnight. When something impacts 1/6 of your economy and every single person in this state, every single person in this room, every single person in this country, it is actually not possible to transform all of the healthcare systems and delivery systems overnight. It actually takes time. So the Affordable Care Act is actually implemented into phases. And so there were major changes in the law that happened in 2010 when it was passed. There are other changes happening now in 2011, others in 2012, 2013, and the major last provisions take into effect in January of 2014. And so we'll get into the details of many of those pieces as we go forward. But I wanted to answer this question around healthcare and jobs. Does healthcare cost us jobs? I mean, is the Affordable Care Act costing us jobs, or is it helping us in jobs? Well, I'll just tell you what I know to be facts that were given to us from the White House on the 1-year anniversary of the Affordable Care Act. And that is on the 1-year anniversary, at that point, 1.4 million private sector jobs have been created in the United States of America, of which 243,000 of them were in the healthcare industry, which is about 17% of all job creation was in healthcare. Also, there's a major provision within the Affordable Care Act that invests significantly in growing, training, and developing a primary healthcare workforce to make sure that we can, again, focus on prevention, focus on primary episodic care that helps us to lower the cost on the front end so we don't have a lot of acute care on the back end, which is the most expensive kind of care to get. And I'll talk to you in greater detail momentarily about some of those things that we've been able to do because of the Affordable Care Act and how we're growing the population of primary care physicians, physician assistants, nurse practitioners, behavioral health specialists, dentists, dental hygienists. Tremendous investment going into those healthcare professions, thus creating opportunities for people to have jobs and other jobs attached to that. So there's significant investment from the Affordable Care Act in working to help create jobs and support jobs in this state and all of our communities. But at this point, what I'd like to do is to introduce someone again who already introduced himself, but is in a very important role in the department at HHS. Saul Ross is our National Business Outreach Director for the department and for Secretary of Civilians. He spends his time engaging the small business community, the media